Jessica Batterson here again from Contour Dermatology. We're going to talk about acne today. So what is acne? Originally we thought it was coming from little microcomedones. So for comedone, think whitehead or blackhead. But it seems to come from an inflammatory pathway, and it's a combination of things. So it can be genetic, but it can also be from your hair follicles getting plugged up, or an overproduction of oils on your face, and you can even get a type of bacteria that causes the acne to colonize and kind of have an overproduction of it. A little bit's normal, but a lot of it's what starts to cause those flares. So when all of these combined, that's when you start seeing the breakout. Typically, we're gonna see young people during puberty when the hormones are flaring in every which direction. Those are most common, but it can happen to anyone after puberty. 85% of people are gonna get this at some point in their lifetime. So just know it's something that's very common and it's treatable. There's a lot of options. For diagnosis, we like to see comedones on the face, so we're gonna have you come in to our office. We also take into account there's a couple different types of acne. So you can get nodular types, where maybe you have more swelling than most people are used to. It can also be caused from certain medications. So that's why we like you to come in so we have a thorough understanding of what's behind your acne and what's driving it. If we think it's going to be anything in the endocrine system causing too much oil production, we'll order labs and we'll go down that road. For treatment, like I said, there's a lot of treatment options. Typically, if it's mild, we're gonna start you off on benzoyl peroxide. We might combine that with a topical antibiotic. So these can be as face washes, creams, anything like that. And we really tailor every treatment to the patient. So we, look at what is working with you, and we give it a good amount of time to see, is it effective? And if it's not, we change it. It's a constantly revolving door, and we're happy to help you make those decisions along the way. We can use chemical peels to help get rid of active lesions. We can use some of our lasers, such as the smooth beam, to also help with active lesions. You also hear about oral medications. You can be on antibiotics to help calm down that overgrowth of bacteria I was talking about earlier. Or we can use Accutane, which is great at clearing up the acne and helping it kind of go into a remission, where then we get you off of it and we're able to get you more onto the topicals, the easier to manage medications. And the biggest thing with acne is you want to treat it. Studies are showing that even if you just have whiteheads and blackheads and it doesn't seem too bad, you can still get those acne scars from them. And it's a lot easier to prevent the scars from forming than to be chasing them afterwards and trying to get rid of them. So kind of kickstart your acne treatment, come in, and we'll help you decide what's the right path for you.